Sagip Buhay.
Sagip Buhay.
Maghahatid sa inyo ng mga kaalaman upang sumagip ng buhay ng ating mga kababayan gamit ang mga halamang gamot sa ating kapaligiran. Sagip Buhay.
Sagip Buhay.
Magsusulong ng patuloy na pagtuklas ng lunas ng mga sakit na nagpapahirap sa mamamayan. Sagip Buhay.
Sagip Buhay.
Magtuturo at magbibigay gabay sa kalusugan at kabuhayan upang umunlad ang sambayanan. Sagip Buhay.
Sagip Buhay.
Ang sasagip sa mga nawawala ng pag-asa dahil sa kanilang karamdaman at kahirapang nararanasan. Sagip Buhay. Sagip Buhay. Makakasama ninyo ang may likha ng mga produktong pinag-aralan, may bisa at subok na.
Sagip Buhay.
Narito si Patrick ROQUEL. Alam nyo ba, ang chlorophyll ay nagbibigay ng lunti o green sa mga dahon na kinakain natin? Kaya dulot nito ay kalusugan sa ating lahat. Sa tamang proseso, gamit ang tamang temperatura sa pagtutuyo ng mga dahon, ay makukuha ang chlorophyll. Kaya narito na ang Immune Advance. Immune Advance. May sangkap na lagundi, Vitex Negundo, malunggay, vitamin C at zinc. Immune Advance. The Power Immunity Vitamin. Ang Immune Advance ay may quad power. May 4 times more immunity. Kaya advance ang kalusugan sa green. Immune Advance is a support for a healthy immune system. Another quality product of Rich Corp. Para sa karagdagang impormasyon, mag-text o tumawag sa 0919-000-1738 at 0922-893-8883. Sundan sa FB page, Puno, Sagip Buhay. At mag-subscribe sa YouTube, Puno, Sagip Buhay.
Citronella magtanim, maghanda ka. Huwag maawa sa lamok, patay na! Nang andas citronella,
Andas take it away.
andas citronella.
Natural take it away.
Siyempre belan gamitin, lamok ay patayin. Tara mag-andas citronella. Mosquito, I'll kill you with andas citronella spray.
Mag-andas citronella.
Mosquito, I'll kill you.
Mag-andas citronella.
Huwag ka ika'y papatuyin.
Citronella.
Mosquito, I'll kill you.
Mag-andas citronella.
Mosquito, I'll kill you. Andas citronella. Mosquito, I'll kill you.
Magandang araw Pilipinas, magandang araw Luzon, Visayas at Mindanao, gayon din sa lahat ng ating mga kababayan sa iba't ibang panig ng mundo. Welcome po sa ating palatuntunang Sagip Buhay. At syempre, ang palatuntunan pong ito ay inyong napapanood sa ating Katipunan channel at sa ating Puno Sagip Buhay. Bisitahin niyo po yan at pwede rin po kayong mag-comment yan. At syempre, bisitahin niyo rin ang YouTube account ng Puno Sagip Buhay. Magandang umaga, Sir Patrick, ang tunay na bida ng palatuntunang ito.
Ay, gandang buhay sa ating mga kaibigan na nakikinig right now. Sumali sa ating sa guest natin, no? Dito sa ating Sagip Buhay. Dalay kalusugan at kabuhayan. Sa iyo, Ma'am CATHY, good morning. Sa mga nakikinig sa ating mga kababayan na NCR, Luzon, Visayas, Mindanao. Maging sa ibang bansa, may mga nakikinig sa atin, Ma'am CATHY. Magandang buhay po sa inyong lahat. Yes.
Oo. Nako, ay itong mga panahon na ito talagang hindi pa rin nawawala yung ika nga natin problema sa COVID at problema sa diabetes, 'di ba? At tama-tama yung ating pag-uusapan ngayon ay tungkol diyan. So curious lang ako, Sir Patrick, meron bang contribution ang pagiging diabetic kaya ka nakakakuha ng sakit ng COVID-19? O kumbaga parang meron kang diabetic, ito bang kumbaga mas malamang ba na lalala yung pagkahawa mo sa COVID-19? Medyo
Yes,
may echo lang, paki-mute
may
lang
echo
kung
Medyo may echo lang, paki-mute lang.
Unmute natin, no? Dapat may nag-unmute. Yan, wala.
Okay.
Good. Yes. O yan, Ma'am Cathy, ang ating actually topic, no? Naganda natin itong COVID-19 and diabetes. Di ba? So, importante dahil marami sa atin ang diabetiko. Ako, isa na doon. Pero paano natin maniligtasan itong sinasabi nga nating pandemya na meron tayo right now. So, yan yung ating presentation, no, for today. At kung sakali naman na-miss nila yung ating mga ibang episode, no? Tinatapos na natin yung mga diabetes, yung mga practical na kaalaman about diabetes, no? Yung different types, yung type 1, type 2 diabetes, at saka yung pre-diabetes, di ba? At saka yung nagkaroon tayo ng mga complications, and especially yung eye problem. Now, ano ang magagawa natin, no? Lalo na may mga kamag-anak tayong diabetiko or mga may kilala tayong diabetic lalo sa panahon ng pandemya. So everyone needs to be careful, no, to avoid the coronavirus that causes COVID-19. Okay? If you have type 1 or type 2 diabetes, you should be even more cautious. Okay? Your risk of catching the virus isn't higher than anyone else. Okay? But you could have worse complications if you do get sick. That's especially true if your diabetes isn't well controlled or managed, no? And you should consider getting vaccinated or reduce your chances of getting the virus. Kaya yun yung ating nakita sa ating mga slides. So pakita natin na Ma'am Roxanne yung ating slide, no? So we can start with our presentation. So in addition to reduce your chance of getting infected, no? Ito yung mga dapat natin ginagawa. So overall, no? One, keep your distance from other people. So next slide tayo. Use good hygiene. So karaniwang sinasabi yan, di ba, na narinig natin sa ating different media. Okay, so different slide tayo ngayon, Roxanne. And then keep your blood sugar under control. Mamaya i-discuss ko sa inyo ano ba itong normal blood sugar, no, na kailangan nating i-maintain. And have a plan in place, no, in case you get sick. Kagaya ko po nung time na nagkaroon ako ng COVID, no, last May. So I am a diabetic person. I'm maintaining medicine and then anti-rejection drug because of my post-kidney, no. Because I am a post-kidney transplant, no. So nung time na nagkakaroon ako ng na-infect na kami because my wife ang naunang na-infect, no, during the time no talagang kasagsagan ng COVID that time. Wala pa kaming vaccine that time, no? At nag-aantay pa rin kami ng tawag from our government. And true enough, nauna siyang nagkaroon ng nahawa niya ako, but because talagang I keep myself na talagang well-maintain yung aking blood sugar at saka yung mga different thing na ininom ko. So nagkaroon ako ng plano. Ang sabi ko nga sa sarili ko, unti-unti ko nararamdaman, but meron ako panlasa, may pangamoy pa ako. And dumating yung point na nawawalan ako ng ganong kumain. So naging plano ko is really going to the hospital kasi doon may pagkain at maalagaan yung aking bagong kidney. So yun talaga ako nagkaroon ng plano. Okay? So ano ba yung blood sugar na sinasabi natin? Na kailangan maging control ang ating blood sugar. Next slide. So itong blood sugar natin, actually, as a normal level, which is normal range na meron right now, no, as given and recommended, usually nasa mga 70 to 105 milligram per deciliter. Okay? Yan ang dapat na mini-maintain ng normal person, no? But of course, pagka yung sugar level ng diabetiko, it should be at least less than 100 milligram per deciliter after not eating or having fasting for at least 8 hours. So yan dapat. And this sugar level should be less than 140 milligram per deciliter 2 hours after eating. Kaya usually, pagka nag-test tayo ng blood sugar natin using the glucometer, di ba? It will be after we wake up or after 2 hours after meal or before meal. Before meal and after meal. So doon tayo kumukuha ng ating blood sugar. And during the day, levels tend to be at their lowest just before meals. Okay? For most people without diabetes, blood sugar levels before meals hover around 70 to 80 milligram per deciliter. For some people, 60 is normal. To others, 90 milligram per deciliter. Okay? What is this low sugar level? It varies widely too, no? Many people, people's glucose actually won't ever fall below 60. Okay? Why? Even with prolonged fasting. Okay? Because when you diet or fast, the liver keeps your levels normal by turning fat and muscle into sugar. Okay? And a few people's levels may fall somewhat lower. So yun. Kaya nagtatrabaho pa rin yung fats natin, no? And muscle natin to bring yung ating blood sugar into normal level. Okay? So, ano now yung mga complications ng coronavirus na nagbibigay sa atin ng mga sinasabi nating mga complications nito. Next slide. Okay? So, sabi nga natin, may mga complications tayong maaring makita during the stage na nahawa na tayo ng COVID, no? Ito yung tawagin natin yung mga acute respiratory failure, pneumonia, at saka yung ARDS, which is I will discuss, no? If you have COVID-19, the illness that comes from infection with the recently discovered coronavirus, your symptoms may be relatively mild and manageable at home. That's true for most people, no? But if you are older or have another illness, such as diabetes or heart disease, you're most or more at least for the serious form of COVID-19. Okay? Some people, usually about in 1 in 6 people, will have complications, including some that are life-threatening. Okay? Many of these complications may be caused by a condition known as cytokine release syndrome. So maririnig natin yan, no, sa mga doctors at saka yung mga napag-uusapan right now, no, with regards to this cytokine storm, no. This is when an infection triggers your immune system to flood your bloodstream with inflammatory proteins called cytokines. Okay? And they can kill tissues and damage your organs, including your lungs, heart, and kidneys. So yan ang talagang pinag-iingatan, no, na magkaroon tayo or lumala yung ating infection, na magkaroon tayo ng cytokine storm. At yan ang binabantayan, especially sa hospital. Okay? So ano yung mga COVID-19 complications, no, na sinasabi natin kanina? Number 1 is yung acute respiratory failure. Okay? So when you have acute respiratory failure, your lungs might not pump enough oxygen into your blood. Okay? Or might not take enough carbon dioxide out of your body. No? Both of these problems can happen at the same time. Okay? So yan. In several studies of those who have died of COVID-19, acute respiratory failure was the leading cause of death. Okay? So, nando tayo sa respiratory. The second complication is what we call pneumonia. No? Some who catch the new coronavirus get severe pneumonia in both lungs. COVID-19 pneumonia is a serious illness that can be deadly. When you have pneumonia, the air sacs in your lungs become inflamed, making it harder to breathe. Yung naramdaman ko last time nasa hospital ako, parang makatig yung aking chest. And every time I talk, no, parang talagang kinakamot yung aking yung kate. Yun ang nararamdaman natin. And true enough, I have moderate pneumonia yung time na yon. But kung pumasok ko sa hospital, asymptomatic po ako. Okay? Scientists who have studied images of very ill COVID-19 patients' lungs found them filled with the fluid, pus, and cell debris, no? And in those cases, patients' bodies weren't able to transfer oxygen to the blood to keep their systems working properly. So yan yung nangyari pagka meron tayong pneumonia during the COVID-19. So another focus na pag-usapan natin na complication is what we call the ARDS, or the acute respiratory distress syndrome. Okay? So this acute respiratory distress syndrome was one of the most common complications of COVID-19. With ARDS, the lungs are so severely damaged that fluid begins to leak into them. Okay? So, lumalampas na yung mga fluids inside our lungs. No? As a result, the body has trouble getting oxygen into the bloodstream. You may need mechanical help to breathe, such as a ventilator, until your lungs recover. So, yung next slide, makikita natin dyan yung example ng ventilator. That is the pump, no, na ginagamit. Next slide. So pakita natin yung ventilator natin, Roxanne. Next slide tayo. A ventilator is a device that supports or recreates the process of breathing by pumping air into the lungs. Okay? Sometimes people refer to it as a vent or breathing machine. So next slide. Doctors use ventilators if a person cannot breathe adequately on their own. This may be because they are undergoing general anesthesia or have an illness that affects their breathing. Okay? So there are different types of ventilator, no, and each provides varying levels of support. And the type of a doctor uses will depend on the person's condition. Okay? Ventilators play an important role in saving lives. In both hospitals and ambulances, people who require long-term ventilation can also use them at home. Okay? So, yan po. And then, ano ba yung mga other complications? So, diniscuss natin yung about acute respiratory failure. We have discussed the pneumonia at saka yung ARDS na talagang karaniwan nakikita natin yan, no, sa mga pasyente na talagang even at home and even in hospital. Okay? Kasi yung iba, talagang nasa bahay pa lang hindi na sila nakakahinga at pagdala ng ambulances, dun mismo nagkakaroon na siya ng cardiac arrest, no? So marami tayong narinig na ganyan. Another complication is what we call yung acute liver injury. And usually, research shows that the most seriously ill patients run the greatest risk of liver damage. Scientists aren't sure yet whether the virus harms the liver or if it happens for another reason. Okay? Acute liver injury and liver failure are life-threatening complications, no? And acute means happens suddenly, biglaan, kaya acute, no? So aside from the acute liver injury is what we call the acute cardiac injury. The studies of many hospitalized patients with COVID-19 found that some develop heart problems, including arrhythmias and other cardiac ailments, no? But it's not clear whether the virus itself affected patients' hearts or if the damage happens simply because the illness caused such stress on their bodies overall, no? Okay. So COVID-19 also could cause cardiac problems that last long after people have recovered from the coronavirus infection. Watch out, no? Kasi marami pong nagka-COVID na talagang until now, pag nagpa 2D echo sila or having this other laboratory tests, no, nakakitaan ng myocarditis, no. But since the illness is so new, that is not clear yet, no, until talagang nakitaan from different equipments na ginagamit or recommendation ng ating doctor. May mga complications what we call secondary infection, no. And a secondary infection means that you get an infection unrelated to the first problem you had. In this case of COVID, no, it means someone with COVID-19 gets infected with something else. Okay, so a review of several studies done so far on hospitalized COVID-19 patients found that several infections is possible, but not common. Okay, and but not common complication. Sometimes a person fighting off or recovering from a virus gets infected by bacteria. Strep and staphylococcus are common culprits, no? And this can be serious enough to raise the risk of death. Okay? So yan yung another complication, which is secondary infection. Meron ding mga nare-report about acute kidney injury. Okay? But sometimes the damage doesn't heal and people get chronic kidney disease which would need to be managed long-term. So yan yung, may mga nabubuhay naman tayong mga pasyente na nagkakaroon nga ng acute kidney injury but later on, nagiging chronic kidney disease na yan. Okay? So, meron ding disseminated intravascular coagulation na marinig tayo, no? When you have this disseminated intravascular coagulation or DIC, the body's blood clotting response doesn't work right, no? Abnormal clots form, which can lead to internal bleeding or organ failure. So DIC is not uncommon among those who have died or who have died of COVID or with COVID, no? And there are also blood clots, no? It's a condition called DIC nga kanina, causes your body's blood clotting response to work differently than it should, no? Unusual clots form, which can lead to internal bleeding or organ failure and death. And because of that, kaninang nakikita nating mga cytokine storm, no? Even for children, there's what we call the multisystem inflammatory syndrome, no? Especially in children, no? Some children and teens have been hospitalized with a condition called multisystem inflammatory syndrome in children, no? Or pediatric multisystem inflammatory. Okay, doctors are still learning about it, but they think it's linked to the new coronavirus. Symptoms include fever, belly pain, vomiting, diarrhea, rash, headache, and confusion. They're similar to those of toxic shock syndrome or Kawasaki disease, which causes inflamed blood vessels in children. Okay? And of course, nakikita natin yung chronic fatigue for the COVID patients, because some people who have had COVID-19 develop a condition similar to chronic fatigue syndrome. And they have a high brain fog, severe fatigue, pain, trouble thinking, or even dizziness. So yan. So yan mga other complications natin. And most important na nakita rin natin is the septic shock. Okay? As reported, no? Sepsis happens when your body's reaction to an infection misfires. Okay? So the chemicals released into your bloodstream to battle the illness don't trigger the right response. And instead, your organs are damaged. If the process isn't stopped, you can go into what's called septic shock. Okay? If your blood pressure drops too much, septic shock can be fatal. Kaya yan yung mga common complications na mga nakitaan na hospital patients with COVID-19. So ano ngayon now yung mga coronavirus and diabetes na we would like to focus here, no? So next slide tayo. Wait. Diabetes and coronavirus, early studies have shown that about 25% of people who went to the hospital with severe COVID-19 infections had diabetes. This was a survey, last 2020 pa. So now, mas marami, ang percentage ng people na may COVID-19 na merong diabetes. And those with diabetes were more likely to have serious complications, and to die from the virus. One reason is that high blood sugar weakens the immune system and make it less able to fight the infection. So yan yung one common reason. Your risk of severe coronavirus infection is even higher if you also have another condition like heart or lung disease. Okay? So yan yung mga nakikita natin sa next slide. So if you do get COVID-19, the infection could put you at greater risk for diabetes complication. Yung tinatawag nating DKA or yung diabetic ketoacidosis. This DKA, sa mga next slide natin, happens when high levels of acids called ketones build up in your blood. It can be very serious. So yan yung i-explain ko ngayon, ano ba tong ketones nito at paano ito nakikita at paano ito malalaman natin kung are we in the normal stage of this ketone, no? At yung nagkakaroon na ba tayo ng ketoacidosis, no? Or DKA. So, what are ketones and their test? Next slide tayo. Yan, okay? So, usually, a ketone test can warn you of a serious diabetes complication called diabetic ketoacidosis or DKA nga, no? And an elevated level of this substance in your blood can mean you have a very high blood sugar. Okay? So, too many ketones can trigger DKA or diabetic ketoacidosis, which is a medical emergency. Okay? Regular tests you take at home can spot when your ketone levels run too high. Then you can take insulin to lower your blood sugar level or get other treatments to prevent complications. So ano ba tong ketones exactly, no? Ang meaning niya, okay? Everyone has these ketones. Everyone. Whether you have diabetes or not. Oh, okay? Ketones are chemicals made in your liver. You produce them when you don't have enough of the hormone insulin in your body to turn sugar or glucose into energy. Okay? You need another source, so your body uses that instead, no? Fat instead. Okay? So your liver turns this fat into ketones, a type of acid, and sends them into your bloodstream. Your muscles and other tissues can then use them for fuel. So yan yung kumbaga another way, kumbaga kahit na konti yung secretion ng pancreas mo ng insulin, still nagpa-process pa rin yung ating body system, okay, to normalize our sugar or regulate our blood sugar in the body. For a person without diabetes, this process doesn't become an issue. But when you have diabetes, okay, things can run out of control and you build up too many ketones in your blood. So if the level goes too high, it can become life-threatening now. Okay? So makikita natin yan sa mga next slide natin. Yan. Okay? So some people, lalo na yung susunod natin, no? Ito yung, ayan. Okay? Some people who catch the coronavirus have a dangerous body-wide response to it called sepsis. Okay? To treat sepsis, body's fluid and electrolyte levels need to be managed by our doctors. No? So, diabetes ketoacidosis causes you to lose electrolytes, which can make sepsis harder to control. Okay? So kaya importante na talagang there's a doctor regularly checking us, no, in case na magkaroon tayo ng COVID-19. So ano ba yung mga tips to avoid infection? So yan yung sa next slide. Sabi nga, number 1, doon na tayo sa tips. Hey, stay at home, di ba? So the best way to avoid getting sick, of course, is to get vaccinated or stay at home, no? Stay home as much as you can. Actually, sa US, no, as I research it, meron silang tutawagin yung Americans with Diabetes Disability Act, no? Wherein people with diabetes have the right to reasonable accommodations, no, at work. That includes right to work from home or take sick leave when you need it. Sana meron din tayo sa Pilipinas, di ba? So if you have to go out, keep at least 6 feet away from other people and wear a face mask if you were unvaccinated. Wash your hands or use hand sanitizer often while you're out and when you get home. Okay? So next slide. Sabi nga, stay physically fit, exercise regularly, eat a nutritious diet, and don't smoke. Yan according to our WHO. Diba? So another slide. Sabi, follow the golden rule. Wash your hands frequently with soap and water or use alcohol-based hand sanitizer or hand rub. Okay? So, stay positive according to WHO. And yan din ang nakikita natin, no? The time na naka-quarantine tayo, yung sa ating next slide. Avoid the alarmist news, yung lalo na mga fake news. be connected to friends and family, and have a hobby, no? During this time of quarantine. Pero at least bumababa na yung COVID cases natin, no? Kaya I think nag-announce na pwede nang marami nang pwedeng lumabas, no? This week. So important is also yung ating physical distancing, no? And sa mga next slide natin yan. If any member of the household shows symptoms of COVID-19, seek medical advice and follow your local health authorities guidance. Okay? In case na dahil nga meron tayong diabetes, no? Also wash your hands before you give yourself a finger stick or insulin shot. So sa mga next slide natin, this next pa. So to protect you, everyone in your house should wash their hands often, especially before they cook for the family. Okay? So next slide yon. And of course, sa next slide, get isolated. So yan yung paggagawa ng insulin, pag-take ng insulin shot. Okay? So, ano naman yung ating dapat na gawin, no? As a diabetic people, no? Ano yung mga dapat planuhin natin? Magkaroon dapat tayo ng plano in case, no? In case na magkaroon na tayo ng infection or meron na tayong exposure sa COVID-19. So what are these COVID-19 diabetes plans? Okay? So your COVID-19 diabetes plans, number one, of course, importante pa rin yung social distancing, and shelter-in-place rules may make it harder to get the supplies you need. Stock up on enough goods to last you for a couple of weeks in case you get quarantined. Okay? So dapat nasa tabi mo na yung mga goods na yan at saka yung mga kailangan mo, no? As a diabetic person. Make sure you have enough food, especially healthy carbs like whole wheat, crackers, vegetable or noodle soup, and unsweetened applesauce. Kung ano man yung mga unsweetened na available, no? Na commercially available, no? Simple carbs like honey, sugar, sweetened soda, yung mga soft drinks, pwede pa rin. Basta nakikita na bumababa yung nagkakaroon ka ng dizziness na, di ba? Kasi alam mo na medyo bumababa na yung blood sugar mo. Okay? Kaya kailangan pa rin natin yan. Pero wag regularly mong inumin yan sa room mo or rest. Magiging uncontrolled yung blood sugar niyo po dyan, no? Okay? So, even fruit juice, kailangan natin sa ating room yan, or hot candies in case your blood sugar dips, no? Talagang nakita natin na bumababa na. And the maximum number of refills and other medications, no? Like for example, later on, emphasize natin yung using of the ketone strips or yung ating glucometer test kits, no? Kailangan na meron din tayo dyan kasi regularly dapat nakukuha natin yung ating blood sugar, monitor natin ating blood sugar level. And of course, importante yung mga phone numbers natin, no? For your doctors and health insurance company kung talagang kailangan tawagan na. Okay? So, Medicare and some private insurance companies now cover the cost of telehealth visits, even sa telemedicine, no? Even a PhilHealth right now ay kino-cover na po yung ating binabayaran sa pagkakaroon ng mga teleconsult, no? Especially when you reported that you have a COVID-19 infection. Okay? So if you have questions for your doctor, you can ask by video, chat, or phone instead of going into the office. Okay? So when you talk to your doctor, ask how often to check your blood sugar and ketones, no? And how to adjust your diabetes medicine if you're sick, no? And what cold and flu remedies, no, are safe for you to take. So yan. Okay? So if you show COVID symptoms of COVID-19, self-isolate yourself, wear a mask around the others, seek medical advice. So yan po yung recommended, no? So when we are at home and in home quarantine. So what to do if you get sick? Okay? So next slide. If you start feeling sick, stay at home or stay home. Check your blood sugar more often than usual. Okay? COVID-19 can reduce your appetite, kagaya ng sinabi ko nga kanina, di ba? Yung sinare ko sa inyo, and cause you to eat less. Okay? You also need more fluids than usual. When you're sick, keep water close by and drink it often. Yung nangyari po sa akin yung time na talagang hindi asymptomatic ang feeling ko noon, but COVID infected na ako. Napansin ko, dahil lagi akong natutuog, dahil sa takot ko nga na mag-pursue yung mag-multiply, masyado yung COVID coronavirus sa katawan ko. So, panay ang aking pagtutuog. Hindi ko na malayan dahil twice or 3 times a day ang aking pagtutuog noon. Bumaba na pala yung aking sodium. That's why nawalan ako ng ganang kumain. Or unti-unti ko na nakikita na nare-refuse ko yung food. So, ang sabi ko nga, ang plan ko is really, once na nakaramdam ako ng symptoms, I will go straight to the hospital. Mabuti na lang kaibigan namin yung mga doctors namin doon, kaya madali kaming nabigyan ng admission. Okay? So, yan yung importante sa pagpaplano, no? During the time na meron kayong diabetes at during this pandemia ng COVID. No? Some other over-the-counter medicines that relieve virus symptoms like fever or cough can affect your blood sugar levels. So high doses of aspirin or even yung mga ibuprofen, no, can lower blood sugar levels. Okay? Yung mga paracetamol can cause falsely high readings on a continuous glucose monitor. Okay? So many liquid cough and cold medicines are high in sugar, which can raise your blood sugar levels. So before you take them, check with your doctor, or if you have taken them, tell your doctor, no? Kasi importante yan. And so that your blood sugar are, pagka yung talagang nakita natin yung blood sugar are really out of control. Okay? So really help and really seek the help of our doctors. So call your doctor if you get coronavirus-like symptoms, no, such as dry cough, fever, or shortness of breath. Okay? Have your most recent blood sugar and ketone readings available to share with your doctor. Get medical help right away if you have, no, moderate or large ketones. Mamaya, discuss ko pa rin yan, no? Yung sinasabi nating DKA symptoms like tiredness, weakness, body aches, vomiting, or even belly pain. And there is a severe shortness of breath. Okay? So yan yung mga common signs and symptoms na talagang makakakitaan ng isang diabetiko. So ano na ba itong ketone test? Next slide. Okay, so importante yan. So sabi nga natin, meron tayong patawagin yung ketone test, no? Especially sa urine natin, no? In urine test, no? The test measures ketone levels in your urine, no? Normally, meron tayong mga strips, dati ang tawag namin yung combistics, eh. Because I'm a medical technologist, so we used to use these combistics, no? Itong ketone test nito, at differently, makikita mo dyan, yung different colors, no? Yun yung guide mo kung magiging nakita mo na kung negative, trace, positive 1, positive 2, or positive 3 na, no? Yung infection do sa or yung test ng ketones mo sa katawan mo, or even the blood sugar in your urine, no? So normally your body burns glucose or sugar for energy, no? If your cells don't get enough glucose, your body burns fat or for energy instead, kagaya ng sinabi nga natin through the liver. So this produces a substance called ketones, okay, which can show up in your blood and urine. High ketone levels in urine may indicate diabetic ketoacidosis. Yan na po yun. Kasi nag-spill na sa urine mo itong ketones neto. Okay? And a complication of diabetes that can lead to a coma or even death. See? So, A ketones in urine test can prompt you to get treatment before a medical emergency occurs. Kaya importante po to sa ating diabetiko, di ba, na regularly nakikita natin, na nababasa natin even the ketones in our blood and in our urine. Kasi sabi nga natin, pagkakaroon ka ng diabetic ketoacidosis, one, pagka uncontrolled ang blood sugar mo at masyado ng mataas. Okay? At nagkakaroon ka na ng spill sa urine mo, that's why nakikitaan mo na yung sugar level sa iyong urine, even these ketones. Okay? So yan, importante po yan. So, another names ng ating ketone test is yung ketones urine test. Pag maghahanap tayo ng combistics na yan, no, na kung saan available po yung reading ng ketones, no? Sa mga, actually sa mga chain drugstores, meron na yung mga yan eh. Even sa mga laboratories, you can buy one bottle of these strips, no? So another is ketone test, no? Another name, no? Or urine ketones or ketones bodies. Yan yung mga other terms ng ating ketones test. Actually, ang paggamit po niyan, yung midstream urine nyo, kumuha kayo sa isang bote na malinis, and then you dip that stick, no? And then after a few seconds, makita nyo, nag-iiba-iba yung color ng mga, nag-iiba-iba kayong yung color based dun sa values na nandun po sa bote. So yun, dun mo makikita kung still negative, kung may trace of this ketone or sugar into urine, or kung nagpa-positive 1 na, positive 2, positive 3, ibig sabihin, marami nang nakikita, no, sa iyong urine. Okay? So, sabi nga natin, this test is used often, no, to help monitor people at a higher risk of developing ketones. And this include people with type 1 or type 2 diabetes. And if you have diabetes, ketones in urine can mean that you're not getting enough insulin. Okay? If you don't have diabetes, you may still be at risk for developing ketones if you, 1, experience chronic vomiting. Gaya nung nakita natin kanina. Number 2, diarrhea. Have a digestive disorder. No? So, kailangan tayo mag-participate in strenuous exercise. Usually, yan yung mga nagpa-participate in strenuous exercise, no? Yung sobrang paggamit ng ating mga muscles, no? Through the exercise, nag-i-increase yung ating keto na yan. And meron tayong yung mga very low carbohydrate diet, no? So, nakakitaan ng ketones yan. And have an eating disorders, no? Even pregnant, no? So, yun yung mga kailangan na regularly na-check up yung ketones sa katawan. So, your healthcare provider may order ketones in urine test if you have diabetes or other risk factors for developing ketones. You may also need this test if you have symptoms of ketoacidosis, which includes yung nausea or vomiting, abdominal pain, confusion, trouble breathing, feeling extremely sleepy. People with type 1 diabetes are really high risk for ketoacidosis. So in blood, okay, what is a good ketone level for diabetics? No? If you do a blood ketone test, lower than, take down nyo po to kung magpapa-blood test po kayo. Usually 0.6 millimole per liter is a normal reading. 0.6 to 1.5 millimole per liter means you are at a slightly increased risk of DKA or diabetic ketoacidosis. And you should test again in 2 hours. No? 1.6 to 2.9 millimoles per liter means you are really at increased risk of DKA and should contact your diabetes team or your GP or your doctors nga as soon as possible. So yan po yung dapat nating salang-alang during the time na may pandemya na, di ba? At diabetic pa tayo. so that hindi tayo mauwi sa mga sinabi nating mga complication. Diba? Importante po yung ating topic. Tama po ba? So, dapat like, mag-share, at mag-subscribe na kayo sa amin. Sa ating Sagip Buhay, sa ating Puno Sagip Buhay YouTube channel and Facebook page natin. So, may mga comments po kayo. Beside ko po yung aking may esposa na magaling na doktor because I'm a medical technologist. Ito pong mga sinasabi po natin is research material na validated po ng ating mga doctors din, no? Especially in US. Kasi talagang nakitaan naman natin na even US right now marami pa rin infected ng COVID-19 and really mas mataas ang risk and increase sa diabetic people, no, sa United States. Kaya doon po tayo kumukuha ng mga research material na ibinabahagi po natin sa ating Sagip Buhay, Kalusugan at Kabuhayan channel, sa Katipunan channel. So, Ma'am Cathy, how are you?
Nako, ang dami kong natutunan, Sir Pat. Grabe. Kasi alam mo, sa totoo lang, siguro sa bilang ng tao na may diabetic, parang may halos lahat sa population talagang problema etong diabetes na to. At makita mo medyo nakakatakot siya at kinakailangan talaga yung mga diabetic people medyo konting disiplina na talaga sa pagkain, pati yung monitoring talaga medyo mas kinakailangan nilang bantayan para kumbaga ma-extend naman yung buhay nila kasi biruin mo, nakita natin kung paanong yung diabetes ang laki pala rin ng contribution kung bakit lumalala itong COVID-19. So, pagka nahawa ka na, bukod dun sa may mga sintomas, katulad kanina, may mga sintomas kang yung shortness of breath din, which is pwedeng, kumbaga, ang COVID-19, ganun din yung di ba? So, kinakailangan talaga pag-iingat at talagang kinakailangan magbantay, yung binabanggit mo kanina na dapat nagbabantay ng glucose, nag-glucose test sa bahay. Tapos nakakatulong din naman yung pag-inom ng mainit na tubig, 'di ba? Yung maligamgam na tubig, and of course yung ating happy cha natin, nakakatulong 'yan lalo na yung ating 1 Immune Advance. I understand, Sir Pat, nakakatulong din sa bloodstream natin lalo na yung malunggay, no? Tama ba ako, Sir Pat?
Kaya ginawa nga natin itong 1 Immune Advance. Anyway, siningit mo, ma'am. Actually, kaya nga ang sangkap ng 1 Immune Advance is lagundi, moringa, vitamins, and zinc. It really helps boost your immune system, no? Support for a healthy immune system. At yan ang in-approve ng FDA, no? At talagang natuwa naman ako doon sa... Actually po, itong month neto, November, is a Diabetes Awareness Month. Okay? So talagang kailangan natin ng puspusan ng pagbabahagi ng mga diabetes information topics, no? Kasi alam naman natin na papasok na ang December, kainan na naman, di ba? So medyo pag nawalan tayo ng control, ito na, maraming na hospital during diabetes. Kaya really, during this season of festivity, no? Kahit na COVID, kahit na pandemya pa tayo right now. Kaya importante talaga na regularly nabibigyan natin sila ng information about diabetes topic, no?
Oo. Actually, Sir Pat, hindi naman natin sila tinatakot dahil ito yung mga pinapakita mo kasi ay mga posible na maging paglala, malalang ng diabetes. Pero maganda na rin yun na nakikita natin, nalalaman natin kasi para mabantayan natin yung ating mga sarili-sarili at maiwasan natin na dumating pa tayo sa punto na magsisi tayo, lumala yung ating sakit, lumala yung 'di ba? Kasi ang laki ng epekto. Alam mo yon yung kapag meron kang kapamilya na dinala sa ospital dahil hindi na kaya sa bahay, ang laking epekto, yung burden sa pamilya, mabigat na sa dibdib, mabigat pa sa bulsa, di ba, Sir Pat?
Right, yes. At saka alam mo, yung mga binahagi natin dito are really true complications nakita, no, during the hospitalization ng mga pasyente. Especially yung mga talagang hindi naka-recover, yung mga namatay, no? Mabuti na lang, sabi ko nga ngayon, nakakapagsalita ako at dumaan din ako sa COVID infection na meron akong mga na immunocompromised person ako, no? So kaya talagang importante na ibahagi natin. Sabi nga natin pwede ko naman gawin sa bahay, no? Lahat ng mga healthy tips natin. But of course, because I'm a post-kidney transplant and I'm protecting my kidney, my new kidney, kaya talagang tumakbo rin ako sa hospital para immediate response nila doon sa aking infection. But of course, sabi nga natin, pwede talagang gawin ito as home quarantine, especially kung naagapan natin yung infection. Diba? At meron tayong tamang kaalaman at importante, meron tayong plano.
Correct.
Diba? In case na hindi pa talaga natatapos ng pandemya natin. Okay? So, importante po yan. Kaya, I hope na nakatulong tayo sa ating mga ibinigay na information.
Yeah. And of course, gusto ko lang din Sir Pat, na ang ating mga kasama sa ating Zoom ay i-acknowledge natin dahil
Yes.
Oo, baka may mga katanungan po kayo kay Sir Patrick. Bukas po ang ating ang ating pong linya para po sa inyong mga katanungan. Baka meron po kayong nais na i-komento rin. Nasa inyo po. Si Dr. Ellie nakita ko rin.
Thank you, Ma'am Chona, sa guesting mo. Si CP Pasay City Host, Joseph Uiching. Salamat po.
Hello po, thank you.
Si Ma'am Evie Catalan. Yeah, si Ma'am Banji ba to? Yeah, si Ma'am Joyce Wello, how are you sa Pasig Bayanihan Lions Club? Si Ma'am Lizette Piñon sa Marikina Lions Club. Si Ma'am Nancy Remonde. Si PDG Ro Santillana. Hi Ma'am Ro, thank you sa comment mo. Si Ma'am Rose Peña, ang secretary sa Makati Golden Lions Club. Okay? Even our Rich Corp team nandito po. Nandito rin ang ating SMNI DZYT Tugegaraw. Si Ma'am Sophia Bato. How are you? Si Ma'am Susan Bustamante. Maraming salamat po sa inyong attendance. Sa inyong guest ating talakayan for this episode.
I also want to acknowledge. Actually, may ilang katanungan, but of course, I want to acknowledge yung mga ginagawa po activities ng Lions Club, mga relief operations, mga tulong po na pinaparating ninyo. Nakikita ko po kasi hindi lang through Facebook, but I also have a lot of friends from the Lions Group, from the Lions Club. Iba-ibang chapter kayo, pero natutuwa po ako na despite pandemic, talagang nandyan po kayo to support our Filipino countrymen na talagang nangangailangan po ng tulong, at nagpapasalamat ako personally dahil hindi po kayo nagsasawa na tumulong sa ating mga kababayan sa kahit na anong panahon po. Thank you so much, Lions Club.
Yeah, laging handa natin sa we serve. Diba?
Oo, pero kasi walang tao dito sa baba.
So may mga katanungan ba tayo? Komento, Ma'am Cathy?
Pero
kayo po, sana kung may mga experiences kayo, let it be this is a group discussion, para whatever experience. Kagaya ko, nag-share ako ng experiences kasi importante po yun na at least nalalaman nyo rin, para in case na wag na sana mangyari, di ba? Meron tayong mga plans to do.
Meron lang din pong mensahe dito. Thank you, Sir Patrick. Hearing you informative talk about diabetes. It's knowledgeable. Dapat ingat talaga. Lalo na sa mga aged individuals, yung mga senior citizens natin, ng mga kababayan. Yan.
Yes.
Oo. At sana raw po ay magkaroon din po ng pagpapaliwanag uli about 1 year in advance. Ano po ang nagagawa nito sa ating katawan? Kasi po hindi po niya natapos na simulan yung dating napanood niya. Ayan. Siguro nakinig to sa radyo o sa television, Sir Pat.
Nako, thank you. Actually, itong 1 year in advance natin, okay, ginawa po natin to kasi alam naman natin yung Lagundi, nakapasa na, sa clinical trial, no, as a treatment for mild COVID infection. Okay? 'Di ba? Ibinibigay yan even now sa kasama na ng PhilHealth tsaka sa mga doctors natin. According to Dr. Cecil Maramba Lazarte na gumawa po ng clinical trial. At nakitaan doon, 600 milligram yung ginamit nila or at 1.2 grams. No? But of course, yung nag-proceed po yung clinical trial, 600 milligram na ang ginamit doon sa clinical trial phase 2. Wherein, in 7 to 8 days, gumaling po nakarecover yung pasyente na nag-enroll doon sa clinical trial. Na at I think 90 ang mga pasyente, 278 in total na nag-enroll, no? And then doon sa phase, nakita na 600 mg 3 times a day for 7 to 8 days gumaling, naka-recover yung pasyente. And then yung second phase of clinical trial, kumbaga itong Lagundi ibinigay sa pasyente na may mild COVID at yung kalahati ng pasyente na nag-enroll, ibinigay yung placebo. Okay? At both naman sila naka-recover, nga lang doon sa gumamit ng Lagundi, mas mabilis silang naka-recover, no? Dahil bumalik yung kanilang pang-amoy, no? Yung pang-amoy nila at saka eventually yung panlasa hanggang sa nawala yung COVID virus, no? Sa kanilang sistema. So yun yung maganda sa ating Lagundi. Now, because gusto natin na mabilis kasi Lagundi sa medicine, no, herbal medicine sa Philippines. At yan ay aprobado na for asthma and cough at pinag-aralan na for COVID. Okay? At approved ng FDA for bronchodilator. Para mapabilis natin yung approval ng FDA, so ginawa namin supplement yung Lagundi wherein 200 mg ang kinuha ko dun sa dosaging namin, no, na yung formulation. And then nilagyan natin ng 200 mg na malunggay kasi nakitaan nga namin nung time na nagre-review tayo na marami palang nawawala ng ganong kumain, loose yung kanilang immune system, di ba? Mahina yung katawan at kaya nagkakaroon ng other infections. Kaya nilagyan natin ng moringa para masustainan yung protein, yung blood circulation, yung ganda ng blood system niya, no? And nilagyan natin ng non-acidic vitamin C and zinc, which yung zinc is very good for healing. Right? Now, with this as a supplement, kung wala ka namang infection, 2 or 3 cups a day is very good para, maging safe at protected yung katawan mo. Because this is a support for a healthy immune system. But if you have already sickness, for example, even fever, diarrhea, no? Ako, madalas akong nagda-diarrhea, no? Meron ka ng shortness of breath, nawawala na yung panlasa mo, umabagsak na ang palagay mo yung immune system. 3 capsule of this 1 in advance kasi 200 mg of Lagundi times 3. It's already 600 mg, di ba? That's already a dosage per medicine. And with others, no, 3 times a day with others ingredient. So 3 capsule 3 times a day is already a medicine. Okay? So when you take this 3 times a day, sabi nga natin, yung ating vitamin C na na-take is already 900 mg, sufficient to support your body against infection or to protect you. And the zinc is already 36 mg. Sa 3 capsule 3 times a day. Meaning to say, in a day, kailangan 40 mg lang yung zinc na tinitake mo. It is sufficient, no? Para, mag-heal yung katawan mo against these diseases or any infection. Kaya, tamang formulation yung nagawa natin dito sa 1 in advance. Okay? Yan po yung explanation behind this 1 in advance formula. And really a support for a healthy immune system.
Nako, napakabilis ng oras, Sir Padre. Nagpas na tayo sa oras.
Anyway, so
kailangan na tayo magpaalam. Okay,
tayo. Salamat po sa mga nakinig at talagang inano yung aking invitation. Bubulol ako. At sana po every Wednesday meron po tayong programang Sagip Buhay, Dalay, Kalusugan at Kabuhayan. Always stay tuned with us at i-like niyo po, i-share at subscribe niyo po yung ating FB page at saka YouTube channel nating Puno Sagip Buhay. No? Kung may mga katanungan po kayo, you can always send your message sa FB page nating Puno Sagip Buhay at willing naman po kami sagutin yung mga comments and issues and even yung mga queries niyo po. At kung ano man na consultation na kailangan natin, my wife is a doctor, my son is now graduating as a doctor of medicine, no, sa Far Eastern University, na makakatulong din sa atin, no. So salamat sa inyo, Ma'am Cathy, salamat sa iyo.
Thank you. Thank you, everyone.
Salamat po, Sir Patrick. Thank you, Ma'am Cathy. Salamat.
Ingat po kayo lagi.
Thank you.
May ubo, may plema, hirap sa paghinga, makating lalamunan, matamlay, at may nararamdamang sakit sa katawan. Happy Cha Lagundi Tea. Happy Cha Lagundi Tea. Ang cha ang magbibigay ginhawa, kaya buhay mo ay happy kasi healthy ka na. Happy Cha Lagundi Tea. 100% dried lagundi leaves, all natural and organic. Sigurado ang kalidad, puro at subok na. Richcorp is the supplier of quality Vitex Negundo in the market. Happy Cha Lagundi Tea. FDA approved as bronchodilator, reduces asthma and cough, at tuklasin ang marami pang health benefits ng Lagundi Vitex Negundo. Maging healthy, maging happy, mag-Happy Cha. Para sa karagdagang impormasyon, mag-text o tumawag sa 0919-000-1738 at 0922-893-8883. Sundan sa FB page Puno Sagip Buhay at mag-subscribe sa YouTube Puno Sagip Buhay. Citronella Andas.
Citronella Andas.
Ang kauna-unahan at natatanging all-natural derma antibody spray na magbibigay proteksyon laban sa virus, bacteria, fungi at insekto. Citronella Andas all-natural derma antibody spray. Panlaban sa pandemya at nakamamatay na mikrobyo. Nagtataglay ng pure citronella grass oil at water extract o hydrosol dahil distillation ang paggawa nito. Citronella Andas all-natural derma antibody spray. 100% oil and water from green leaves of citronella, all natural ingredients, ang inyong pangkontra at depensa sa laganap at kinatatakutang mga sakit. Citronella Andas all natural derma antibody spray. Protektado ka na, detoxifier pa, tanggal mga skin antigens, panayad sa skin o kutis mo, non-oily at hindi nakaka-dry. Citronella Andas all natural derma antibody spray, a quality product of Richcorp, enriches lives. Richcorp, #Healthy Nation Philippines. Para sa karagdagang impormasyon, mag-text o tumawag sa 0919-000-1738 at 0922-893-8883. Sundan sa FB page Puno Sagip Buhay at mag-subscribe sa YouTube Puno Sagip Buhay. Inyong napakinggan si Patrick ROQUEL sa kanyang palatuntunang Sagip Buhay. Ang gabay ninyo sa kalusugan at kabuhayan. Sagip Buhay. Hanggang sa muling pagtatanghal.